Close your eyes. Picture yourself on the beach. Take a deep breath. All you have to do is take a deep breath in and out. Inhale and exhale. However, what if I told you that telling someone to just breathe isn't always helpful and could worsen the anxiety and possibly lead to an all-out panic attack? You see, there is a cyclical or recurrent nature that can feed your brain negative thoughts. But suppose this technique of taking a deep breath does not work for the person. What happens next? So today, I will do my best to explain how the well-meaning phrase of just take a deep breath can actually make the situation worse, and what techniques I have found as being useful if I'm ever having a panic attack, or if someone else is suffering from a panic attack, what I would do and what techniques I would use. So what is a panic attack? A panic attack, according to the Mayo Clinic, is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. As with this photo of feeling enclosed within a box, a lot of times panic attacks present in a way of you feeling helpless and lost. Some common symptoms of a panic attack include sense of impending doom, rapid pounding heart rate, sweating, trembling, chills, hot flashes, nausea, abdominal cramping, chest pain, headache, dizziness, numbness, and once again, I put this photo of somebody being trapped in a box because literally a lot of times you feel like the space you are in is enclosing. Now, as stated at the beginning of the video, panicking people are often told to calm down and just take a deep breath. But for someone hyperventilating during a panic attack, deep breathing is a very bad idea, because hyperventilation happens when people breathe so quickly and deeply that they expel an unusually high amount or surplus of CO2, meaning carbon dioxide, which in turn causes symptoms like dizziness, numbness, and feelings of wanting to pass out. Those symptoms tend to make people feel like they're suffocating, so they breathe quicker and deeper, further exacerbating this problem. Also, let's keep in mind that oxygen availability in the brain is reduced by as much as 40% as a result of about a minute of overbreathing or hyperventilation. Not only is oxygen availability reduced, but glucose critical to brain functioning is also reduced as a result of cerebral vasoconstriction, meaning you're not getting enough blood to your brain. With this in mind, it is not surprising research has shown that focusing on specific breathing exercises to reduce overbreathing has a central role in controlling panic attacks and reducing stress. Once again, you will often hear advice to fill your lungs up with air and take a deep breath to overcome a panic attack. Once again, this is wrong, and any advice to breathe more may worsen the attack. The key to overcoming a panic attack is to breathe surprisingly less, which is to reduce hyperventilation. And one thing I want to let everyone know is I'm not saying that learning to control your breathing or taking a deep breath is completely wrong. I'm just stating that if you've never practiced this and somebody says, and you're having a panic attack, oh, just take a deep breath, it's not necessarily going to work for you. I'm trying to show you both sides of this. So I'm not against it, I'm just showing you what research has shown as well. So breathing exercises, in my opinion, are very important, but that also focus on slow, rhythmic, nasal, diaphragmatic breathing are key to restoring that calmness. So once again, it's something you need to learn, and it takes time. Once learned, they can be performed anywhere, at any time, to overcome a panic attack and reduce stress, or even if you feel one coming on. So many breathing therapies focus on getting patients to breathe slower, but slow breathing alone may not help alleviate a panic attack if patients are still, as I said, hyperventilating. So if you suffer from frequent panic attacks, it will help to have your breathing assessed, I would say. So going to see a doctor. For many, simply changing the way you breathe is all it takes to prevent attacks occurring and restoring the ability to cope better with your own stress, which makes sense. So real quick, let's just do, I want to give some insight on what can help prevent a panic attack, and just good exercises for anyone to know, even if you've never had a panic attack. So let me just give some simple tips real quick. If you think you are experiencing a panic attack, or if you potentially in the future want to prevent one, you should be practicing these, even once a week. Or if you feel like if you do have a lot of panic attacks, you should be practicing these daily. So number 1, if possible, sit down and adopt a relaxed, upright posture. So I'm just actually going to do this, and I know it's going to be hard to see. So sitting upright. Close your mouth and try to breathe in and out throughout your nose. So like this. That's the second step. The third step, place the palm of your hand on your belly, which I don't know if you can see, and imagine you are breathing into the palm of your hand. Okay? Number 4, slow your breathing and try to breathe rhythmically. And number 5, this is the hardest part. Try breathing less. I know that's tough to say, but this feels counterintuitive when the feeling accompanying a panic attack is usually one of suffocation, or like you're drowning or being enclosed. However, this is key to restoring brain oxygen and switching off the fight or flight response. Now, once again, I want to state, I'm just trying to give you a different outlook on the whole take a deep breath aspect. It's not necessarily wrong, but if you've never practiced deep breathing before, then if you're having a panic attack and somebody tells you that can make it a lot worse for you, which I have seen in the clinical setting. So I try to avoid just saying take a deep breath, because it can confuse a patient, or actually cause them to actually become a lot more scared and pass out. And finally, let's discuss some alternative ways to prevent panic attacks. And if you have not done so already, please like and subscribe to the channel, hit that thumbs up, and leave a comment as well. So let's jump right on in to this final part of this video. So number 1, always remember with a panic attack that it will pass. It is great to remember that no physical harm will be done. However, it can be scary. So always remembering that and keeping that in the back of your mind will benefit you for future possible attacks. Number 2, keep lavender on hand. Working as an RN, some patients respond very well to this scent. It works by tapping in to their senses and taking their mind off of the panic attack. Also, naturally, lavender helps relieve anxiety, so it can be used as a preventative if you feel a panic attack coming on. Other scents can also be used, like orange, lemon, and peppermint. And also, always remember, just because one scent works for one person, it does not mean it will work for another. Number 3, having a peaceful spot. Sometimes having more people around can make the panic attack that much worse. So space is very important. Always ask the person or patient suffering what they prefer. When I have a panic attack, for example, this is the technique I use, and this typically helps me calm down and bring down my own anxiety or panic. Number 4, is exercise. It can be used as a preventative of a panic attack or while having a panic attack. And this is due to your body being able to be distracted by the anxiety or panic attack. And also, it is great and can only be beneficial towards your overall mental health. Number 5 is the 5-4-3-2-1 method. Panic attacks a lot of times can make a person feel detached from reality. This is because of the intensity or severity of the anxiety that can overtake the senses. So the 5-4-3-2-1 method is a type of grounding technique and a type of mindfulness. And it takes a lot of time to actually be able to use this if you're suffering from a panic attack. It helps direct the person's focus away from sources of stress. To use this method, the person should complete each of the following steps slowly and very thoroughly. So I'm going to go through it briefly. So number 5 in this method is look at 5 separate objects around you while you're having a panic attack. Think about each one for a short while. Number 4, listen for 4 distinct sounds. So think about where they come from, for example, and what sets them apart from one another. The third, touch 3 objects. So consider their textures, temperature, and what their uses are. So it's touching 3 objects. The 2 from the 5-4-3-2-1 method, identify 2 different smells. So for example, this could be the smell of your coffee, your soap, or laundry detergent on your clothes, any type of smell around you. And number 1 to the 5-4-3-2-1 method is name one thing you can taste. Notice whatever taste is in your mouth, or try to taste a piece of candy, for example. So I know that was a mouthful, but on number 1, tasting something. And remember, all of this is due to you're trying to get your senses activated so you can distract yourself from that anxiety, or if you are in a current panic attack crisis. And finally, number 6, always take your medications as prescribed or as needed on a PRN basis. You should never ever stop a medication cold turkey, and you should always be under medical supervision, and you should always consult your doctor if you're going to abruptly stop a medication. And I say this as the final one due to a lot of times if you stop a medication cold turkey, you can actually have rebound anxiety, and it can cause suicidal thoughts, it can cause paranoia, severe panic attacks, and it can be quite awfully very scary. So always consult your prescriber. And that is your daily dose of mental health with Adam. Thank you for watching the video. I greatly appreciate it. I completely forgot my lightsaber in the background is on, so you're going to hear noise with that right now, possibly. Please, if you got anything out of the video, please like and subscribe to the channel and leave a comment. I look at all the comments and I will respond to all of them. Once again, thank you. I appreciate you, and I'm just very blessed and thankful that the message has been spread more and more by the day. I love you all. That is your daily dose of mental health. Be on the lookout for another video in about a week, and I'll be telling you more about it in the next couple days. I love you all.